Seizures in dogs are definitely one of the scariest things a pet parent may have to go through. As canine companions go, Chihuahuas are fantastic. They have sassy, super-sized personalities packed into pint-sized bodies. It's easy to see why this breed is popular with dog lovers everywhere, from coach-toting celebrities to the neighbor next door. Unfortunately, much to the chagrin of their owners, these spunky little dogs tend to be prone to some health problems, and recurrent seizures are one of the most concerning issues that face the Chihuahua breed today. In fact, a 2009 health survey by the Chihuahua Club of America revealed that 45% of survey participants had either bred or owned a Chihuahua with seizures of unknown origin, an alarming fact that has many lovers of the breed worried for their future. Watch this video until the end, to learn what to do if your Chihuahua is having a seizure. Common reasons for seizures in Chihuahuas. Hypoglycemia, low blood sugar. This is especially an issue with young puppies who don't eat frequently enough to maintain a good blood sugar level. Since Chihuahuas have a smaller number of fat cells than many other breeds, they don't have much energy reserve to fall back on. Hydrocephalus, sometimes called water on the brain. This is a condition that's caused by an abnormal buildup of cerebrospinal fluid within the brain cavity, and it's one that's common to many toy breeds including Chihuahuas. The increased pressure on the brain can cause poor growth, lethargy, stumbling, and seizure activity. Portosystemic shunt, liver shunt. Another condition that's prevalent in toy breeds, a liver shunt is a blood vessel that carries blood around the liver instead of through it. For Chihuahuas, the defect is usually one that's congenital, present from birth. The shunt prevents the liver from removing toxins from the bloodstream and can limit a dog's access to energy stores. Hereditary. Some Chihuahua breed lines are prone to hereditary seizures that don't originate from any particular health problem. What to do? So, what should you do if your Chihuahua has a seizure? First of all, don't panic, and keep in mind that they're not actually in any pain, just unconscious. If possible, move your pup away from furniture, stairs, or water to keep him safe. You may need to hold your dog still to keep them from flopping around or trying to stand up during the seizure. It's a good idea to time the seizure if you can and keep track of how long it lasts, too, and, if there are multiple seizures, how long of a time period in between each seizure. Also, use your camera function on your cell phone and take a video of the seizure while it's in progress to show your vet. Call your vet for advice right away if your pup's seizure lasts longer than 5 minutes. Don't put your hand or any other object in your dog's mouth during a seizure either. Dogs don't swallow their tongues, and you run the risk of being bitten accidentally. Objects in their mouth during a seizure are also a choking hazard. Stay by your little dog's side to give them comfort and to help calm them down once they stop seizing. They'll need some extra loving care afterward. For some dogs, seizure activity can sometimes become dangerous. Are there foods that can cause seizures in dogs? If your dog is prone to seizures, they should avoid eating any potentially inflammatory foods, including those foods that may trigger an allergy or sensitivity. These inflammatory foods include anything containing chemical additives, wheat, soy, corn, beef, or cow's milk products. Will treatment help prevent your dog from having seizures? There are some medications your veterinarian can prescribe that can help control seizures. You should always discuss treatment with your vet because they can target your dog's specific problem. Alternative therapies may also prove to be helpful in some cases. Can seizures kill a dog? Status epilepticus is a very serious and often life-threatening situation for your dog. This occurs when your dog's seizure lasts for more than 5 minutes. To help stop the seizure activity, intravenous anticonvulsants are needed, or the dog may die or suffer from irreversible brain damage because of the seizure.